All right. Well, g'day everybody, and welcome to the Australians for Mental Health Tasmanian State Election Forum. My name is Chris Gambian. I'm the Executive Director at Australians for Mental Health, and I'm coming to you from Bidjigal country in the south of Sydney here in New South Wales. But everybody else, I can assure you, is a Tasmanian local. On behalf of our partners, Unions Tasmania and the Mental Health Council of Tasmania, I'd like to thank you for joining us for this very, very special event. Tonight, you'll have the chance to hear firsthand from representatives of the government, the opposition, the Greens, and the Lambie Network on what they think about mental health in Tasmania, and perhaps more importantly, what they'll do about it if they are elected at the elections this Saturday. Joining me on the panel is Madison Cutler, a Tasmanian with lived experience of accessing the mental health system. Welcome, Madison. Connie DeGolis, CEO of the Mental Health Council of Tasmania. And hopefully joining us in a minute will be Jess Bundy, Secretary of Unions Tasmania. As I mentioned a moment ago, the questions that Madison, Connie and Jess will ask tonight have been suggested by our audience. And if you'd like to join in the chat, please do so, and you can just do that at the bottom of your screen. Just a note, if anything we discuss tonight is causing you any distress, please do what you need to do to look after yourself. And as always, you can contact the Tasmanian Lifeline on 1800 98 44 34 or Lifeline 13 11 14. I'm now going to give our candidates an opportunity just to introduce themselves. I'm sure they're all known to you, but also say a few words on mental health and their particular approach to mental health. So we might start with you, Minister. Guy Barnett, please introduce yourself to our group.
Thanks very much, Chris, and thank you very much for organising the forum. It's really appreciated, such an important priority for our government and for the community. And I just want to say that the Premier and the Minister for Mental Health and Wellbeing, Jeremy Rockcliffe, does send his apologies and not be able to be with us all tonight. So I'm just there as a representative of the Premier. But certainly as a government, we're proud of our achievements so far in mental health. We know there's a lot more to do, and we've increased the focus on this important area through the creation, as you know, of the dedicated Cabinet Ministry and making mental health and suicide prevention the Premier's priority. In terms of the government and the reviews that have been undertaken in terms of mental health and the system, there's been a lot of input from the clinicians, GPs, peak bodies, the community sector, and importantly, as you mentioned earlier, those with a lived experience. And we've accepted all the recommendations made through the various review reports, and we've invested record funding of $410 million since coming to government, and to make the necessary changes to achieve best practice. And that's really where we want to be, best practice in mental health. So we've recruited 105 additional FTE in statewide mental health services in the last 4 years, with over 70 of those being with lived experience worker positions. And certainly we're strongly committed to the overarching plan for mental health, Rethink 2020 to 2025, and the Tasmanian Mental Health Reform Program, which is being rolled out to ensure that people who live with mental health issues or suicidal distress have access to better systems of care, including alternative services for people to avoid hospitalisation, and the focus on early intervention and prevention. I know that's a key theme, I'm sure, tonight, because that's part of our plan. So I'll just say, in terms of up until the end of January at the newly redeveloped Peacock Centre that opened last year, 690 people in situational suicidal distress received care from Safe Haven, and 1,659 people engaged with the Integration Hub for advice, information and support. 210 people were admitted to the 12-bed Peacock House for short-term stays. Our policy is certainly based on expanding the successful innovative reform program, as mentioned.
I'm just going to cut you off there, mate. We need to hear from the other candidates, so I'm sure some of that will be useful when you're giving your answers in a moment. I'm going to throw now to Anita, if you're ready to introduce yourself, Anita.
Thanks, Chris, and thanks everybody for enabling me to be part of this discussion on such an important topic across Tasmania. It's been my great pleasure to be the Shadow Minister for Mental Health and Wellbeing and the Shadow Minister for Health now for some time. And to me, the two are very closely linked and really are one in the same. if you don't have good mental health and wellbeing, that does affect you physically as well. And there is much more work that needs to be done across our community to provide better prevention services, education services, and also at the other end of the spectrum around emergency mental health services. People are experiencing a crisis in their mental health and wellbeing, and of course acute beds for mental health, which we've seen a significant reduction in recent times, particularly in the south of the state, with the closure of St Helens Private Hospital. I'm going to take the opportunity tonight to share with you a number of the initiatives that we would commit to as part of our election platform when it comes to mental health and wellbeing. I won't go into all of those right now. I'll certainly provide examples of those as we discuss the questions that are put before us tonight, but just to give you my commitment that a Labor government in Tasmania is very committed to working with community mental health providers, whether they be from non-government organisations or government-funded services. We recognise the important layers of work that are done across our community, and we want to work with you to improve those services.
Thanks so much, Anita. Rosalie, we might hear from you next.
Thanks, Chris. Hi, everyone. I acknowledge that we're meeting wherever we are tonight on stolen land that has never been ceded, and I acknowledge the elders of this land, the Tasmanian Palawa Pakana people, and we commit to working for truth and treaty and justice. And in that frame, that is one of the bases upon which we develop our approach to working on the issues of the increasing burden of mental health in the community, the impact it has on individual people, and really beyond them, the tentacles that spread out to everybody. We're all affected. And that approach is to take a holistic one and fundamentally to focus on prevention. And so we want to keep, and we acknowledge and respect the work that's been done, the shift that's happened in Tasmania of focusing on providing supported centres like the Peacock Centre. And we welcome the Peacock Centre and what that shows as a model, and the work that's been done by the Mental Health Council, the sector, people with lived experience, to feed into the many conversations to create a model which supports people to have the acute and professional essential services they needed at times of acute crisis, but also to be wrapped around by services that fundamentally are there to help them stay community focused, be in their supported in their community, so that we, as much as possible, put our energies into keeping people outside of hospitals and the acute care settings. Saying that, we're obviously incredibly affected by the stories of the thousands of people who relied on St Helens for mental health services and for support from different sorts of practices that were provided there, TMS and support for mothers and families. And that shows what happens when an acute care service and therapies are removed from the community. We're only coming to terms and to understanding the impacts that's having, but clearly what it says to us is that there needs to be much more focus on the whole pressures on people and how to support families with professional services and community services and people with lived experience being involved in that conversation.
Okay,
so
thanks, Rosalie. We might
that's
just
enough for now.
Stop there and keep pressing on. And finally, Chris, over to you if you'd like to introduce yourself to the group.
Hi, Chris. Thanks for having me. I'm really excited to be here. I guess I'm the least experienced on the panel in terms of politics, but I bring with me that I have professional and also lived experience of mental health. So I've been a mental health professional now for almost 25 years. I'm a mental health social worker, and I also hold a Master's of Applied Positive Psychology. My approach to mental health is holistic wraparound care, and I'm also really interested in the social determinants of health and mental health. So mental health, even though our acute services and our community mental health services are really vitally important, things like housing and access to nutritious food and being actually to get to see your provider, public transport, all of these things are really vitally important to mental health, and they are sadly lacking at the moment. And the only reason I'm running as a mental health professional is because I've seen how bad that it is in the past 10 years, and I don't feel like I can leave it any longer. I actually don't feel like I have a choice. I feel like I need to step up and try and bridge that gap between decision makers, clinicians, and people with lived experience who have really valuable knowledge to share with us. Thanks, Chris.
Fantastic. Thanks so much, Chris. Now I'm going to throw to our panel, and let me just introduce them again. We have Madison, who is a person who's been very active around mental health issues around Tasmania, and is a person who has lived experience of accessing mental health services in Tassie. We have Connie DeGolis, who is the CEO of the Mental Health Council of Tasmania, and Jess Mundy, who has joined us as the Secretary of Unions TAD. Madison, we might kick off with you. Have you got the first question for the panel? And again, politicians, I'm going to ask you just to keep your answers as succinct as you possibly can so that we can get through as much as we can over the next 45 minutes or so. Over to you, Madison.
All right, opening with a big one. Got Tasmanians with mental health difficulties, especially young people, are facing an inability to access crucial primary care such as GPs, paediatricians and psychiatrists due to extremely long wait lists, closed books and very, very high out-of-pocket costs. If elected, what is your plan to ensure all Tasmanians have access to the right mental health supports and services that they need?
Okay, thanks, Madison. Guy, we might hear from you first.
Yeah, thanks very much for that. Thank you, Madison, for the question. Certainly in terms of the commitment from our government, we've invested some 45 million to implement the extensive recommendations of the CAMS review, which our government commissioned, and that's a big investment. So in terms of that specialist services in development, including the youth mental health service, an intensive mental health service for children in out-of-home care, and youth forensic mental health service. So we've commenced the new CAMS after our service at the Royal Hobart Hospital, established Tasmania's first multi-systemic therapy program, which is operating statewide, established a new patient flow program to ensure consistent intake, referral and assessment processes across the state, and established a new statewide leadership structure. So we're very committed to continuing our mental health reform agenda for children and young people, and certainly our re-elected majority government, and again credit Premier Rockcliffe for his real commitment here. And we will be extending the CAMS outreach clinics in rural and remote areas in the state. Our clinics have already commenced in Huonville, Scottsdale, St Helens and Georgetown. New clinics will be established in Kingston, Brighton, and certainly a suitable location in the northwest. And we've delivered a new CAMS after our service at the LGH, the Northwest Regional Hospital, and delivered a youth-specific mental health hospital in the home, a 2-year trial service being established in the Northwest. So there's some of the things I think hopefully can help assist in that delivering that response.
Thanks very much, Guy. Rosalie, we might hear from you next.
Thanks, Madison. Well, the reason that there's not enough services available, there's many reasons, but the things to do in particular with the Tasmanian government is there's not staff to fill those positions, and there's not incentives to recruit the new staff that we need, the extra people that we need into those positions. So a very strong focus of what we've been talking about this election is how we can build people who are working in the public sector, and how we can provide incentives for them to fill positions, but also to start up new positions, particularly with psychologists, psychiatrists, paediatricians, the things that you've been talking about. We've also committed to hiring a lot more social workers to work in schools, and psychologists. And it's really important for young people, as you know, to have access to sort of place-based, easily accessible sort of mental health support. And we've committed to free public transport so people can get to appointments, particularly in rural areas where it's almost impossible to leave and to travel to appointments. That's a small thing, but a very important thing for those people. And we support the Public Service Union, the CPSU, recognising that we need to have different ways of attracting different skill sets, critical lacks of paediatricians, particularly places like the Northwest and the North, different parts of the state. We need to have specific programs that are designed to attract those sorts of people so that they can be encouraged and supported with housing, etc., to live in regional areas to provide that support so it's there when people need it.
Great, thanks, Rosalie. Chris.
Thanks, Chris. I guess as a mental health professional who's worked in both state and federal government, I find this pretty frustrating because we just don't have adequate funding, to attract staff, but then also to retain them. And then on top of that, morale's pretty low at the moment. Everywhere that I have been, I have had teachers, I've had social workers, I've had psychologists in tears telling me that they're only able to provide a service 1 day a week and they're grossly underfunded for what they do. That's really tough. I have a 14-year-old daughter. I know how important mental health is to her and her friends. And it's, you know what, it's really hard to access mental health services in Tassie as a young person. So, you know, there's a range of different options that need to be explored, but, you know, particularly with use of different technologies that we discovered during COVID. And it's really about getting out and speaking to young people, particularly with services like Why Not, who are the peak body for youth, and actually speaking to youth and asking them what they want and engaging youth where they are. And I think that's something that's really sadly lacking, and that's something that I would like to focus on.
Great, thanks, Chris. And over to you, Anita.
Thanks, Chris. Well, there's a couple of, I'll outline a number of initiatives that we would put in place to improve access to mental health services for young people across Tasmania. In our GP policy that we announced today, we would legislate to allow co-prescribing, particularly around ADHD and other conditions that people are waiting long periods of time to see a paediatrician for across the state, to enable families to get the support that they need and to support their families better from their local GP rather than having to wait to see a paediatrician. The second thing that we plan to do is around preventative health and invest in our community health centres across the state, 23 of them, and provide preventative health checks. And some of those would focus on our young people, and that would be very much about mental health and wellbeing checks for them. And the beauty of that policy, I guess, is it's decentralised and all of our community health centres are scattered right across the state, which would make that more accessible for young people in their local community to be supported. I want to see the progression of dedicated mental health youth beds in the north and the northwest of the state. And if elected on March 23rd, that will be a key priority of mine as the Shadow Mental Health Minister, to have dedicated mental health beds, not hospital in the home beds, but actual dedicated beds. We'll continue funding for a very successful project that's been running in Circular Head, where there have been lots of issues around mental health and wellbeing and a lack of services for young people. So we'll continue that program over the next 3 years and provide funding for that, which is being provided locally as a mental health arch support service in Circular Head. And when it comes to workforce, we acknowledge, you know, right throughout our policies that you can't say you're going to recruit X number of staff without having an underpinning retention and attraction policy. So more recently, we've announced that we will make 500 healthcare professionals across the state service permanent. Up to 25% of our staff are on short-term contracts. That offers them job security and a reason to stay here in Tasmania, and they will be allied health professionals and others who are providing mental health services across the state. We'll also provide free degrees for 50 allied health professionals in our first year of government, and that will include social workers in our schools and across the community as well. And our regional health policy is all about investing in regional communities and providing allied health services across those communities at district hospitals. So those two would be allied health professionals would be providing those services, and mental health would be a focus for them. And we've also got a policy around investing 10 million in our schools per annum to employ more school nurses, social workers and psychologists for our schools. We've developed that policy in collaboration with the unions as well, who have provided feedback to us about the need for that. And as always, because there's the crossover between the federal and state government when it comes to particularly community-based mental health services, we will work constructively with the federal government to ensure that the funding that does come to Tasmania for mental health services goes to the right places, that there's not duplication or resources in the wrong place, and that we can work together to create better services.
Great. Thank you so much, Anita. The next question is from Connie. Over to you, Connie.
Thanks, Chris. So this question really started with an acknowledgement of seeing significant investment and reform in the statewide mental health service, which this person has said has been welcomed, particularly the reform and significant funding to the child and adolescent mental health services. This question, however, points towards community managed mental health organisations. So the question is, given that the vast majority of Tasmanians accessing mental health services from early intervention up to severe and complex are supported in the community, what will be committed to fund, grow and reform community managed mental health organisations and integrate these CMOs with government mental health services to ensure all Tasmanians can access the support they need?
Thanks so much, Connie. Now I'm looking for pretty succinct answers, Polly. Perhaps we'll start this time with you, Rosalie.
Thanks, Chris. Thanks, Connie. The Greens recognise the uncertainty that's been associated in the mental health community sector with funding that's only been allocated annually or for short periods of time, or projects that are trial periods. And so we've committed to the sector to have these 5-year funding contracts, and also to make sure that the sector is being properly indexed to keep up with the real cost, not just of running a service, but also the real cost of wages and the cost of living, so that we can attract people to work in those services. We're also open to working with the sector to talk about wage disparities between people who work in the non-government organised sector, the private sector and the public sector. And, you know, I think we have to have a conversation about how we have a mobile workforce in Tasmania, and there's peaks and troughs in different parts of those sectors, but that means that affects service delivery. So we have to look at what are the actual impediments to people doing that incredibly important work. And overall, we have a big investment in this sector and in the whole health sector, and we do that by making sure that we create extra money in the budget. We won't be supporting a stadium and the money that would go into building a stadium, and we won't, and we don't pretend that we aren't wanting to raise more money to put into the budget by taxing big corporations and actually creating more money to put into the budget to these critical services. The bottom line is it's a desperate need, and it has to be matched with the funding that's actually needed to match the service.
Okay, thanks, Rosalie. Over to you, Chris.
I think this is such a great question, because as we know, wraparound care is so important in terms of mental health. And quite often when people have a mental health issue, it's the community-based organisations that are the first door. They're the front line really of mental health, and it's so vitally important. I would love to see a commitment to talk about ongoing funding for organisations, that the funding is indexed. If the funding is not indexed, it means it's a funding cut. And I think that's what most services are really struggling with. And when I go out and speak to services, I'm absolutely blown away with how they're struggling on such a small budget. And I think they need to be prioritised and recognised as key players in mental health. And that's something that I really want to advocate for. And if I'm lucky enough to be elected and potentially, if we hold that balance of power, that is something I will negotiate really hard on, because I recognise their importance.
Great, thanks, Chris. Over to you, Guy.
Yeah, thanks very much, Chris, and likewise, Connie and the Mental Health Council. Thanks for your work and advocacy. First of all, just want to acknowledge the very significant investment and reform that's already been underway, and again, the Premier and Jeremy Rockcliffe for his leadership, 410 million, as I said earlier, in terms of over the last 10 years, and to completely transform the mental health system in this state, and to head it in that direction that we're going. And we're very supportive of the number of community health organisations with additional funds, both in terms of core funding and project-based funding. We've received as a government a range of proposals from organisations. Part of the budget process for 2024. We'll continue to review those proposals and respond to that. But I just wanted to put in a note that the government's just announced a re-elected majority Liberal government will provide that uplift to the community sector of 12.5% over the next 4 years, together with the 5-year contracts commencing as existing terms expire following the handing down of that 2024-25 budget as and an outcomes-based approach and framework. So as I said, Jeremy Rockcliffe certainly met regularly with the large group of organisations from community and mental health groups, and those meetings have been very valuable, I know, to Jeremy and the government, and appreciate the perspectives and insights, and look forward to working collaboratively to deliver better mental health and wellbeing outcomes going forward.
Thanks for that, Guy. And Anita.
Thank you, Chris. Well, it's a very big question. And the thing that comes to my mind when I think about that question is for me as the incoming Minister for Mental Health and Wellbeing, to actually understand better what services are being provided across our community. Because it feels like at the moment there's a lot of services, and for me I would want to understand exactly what they were being delivered and how we could work as a state government with the federal government, if they're funding those priorities as well and those projects, but B, with those key stakeholders that we would work closely with around funding agreements and the like. We've agreed to that 4% in indexation in our first year of government, but that is accompanied by goodwill to work with the sector to identify fairer funding models into the future as well across each of those community services organisations. So for us, that's just the beginning of the conversation. In my background, I've been involved as a registered nurse working in health and been involved in a number of pilot projects. They work for a period of time, but they're not sustainable, and you just get started on the good work that you're doing and then the funding ceases. So that's something that I feel quite passionately about personally as well, and would like to see some change across the state as well. So it's a massive question, but my commitment to you is that we're here to work with you to understand the level of service that's being provided, to understand the gaps, and to work together to provide better services.
Great, thanks, Anita. And now throw to Jess to ask some questions. Over to you, Jess.
Thank you very much, Chris. Unsurprisingly, I'm going to ask a question about work and mental health, though I promise I didn't write it. This is one from the audience, but I will preface that by saying at Unions Tasmania, we're certainly concerned about the rise in mental health related injuries and illnesses in our workplaces. They're accounting for over 10% of workers' compensation claims every year now in our system, and probably a lot more for people that aren't actually putting in those claims and are struggling as a result of their jobs. So the question is, recent polling by Australians for Mental Health has again shown work as the most common driver of mental health pressure. So what will you and your party do to improve compliance with new psychosocial safety obligations or regulations for employers? So how are we going to make sure, what are your strategies around ensuring that employers are complying with their duties to keep workers mentally safe?
Thanks so much, Jess. And Anita, we might start with you on this one.
Thank you. Thanks for the question, Jess, on behalf of the audience. It's a really important question, and the Labor Party, as you would expect, is absolutely committed to better working conditions and making sure that the mental health and wellbeing of our workforce is looked after and supported. If I go to my role as Shadow Health Minister and looking just at one example of our paramedics and how their current morale and mental health and wellbeing has deteriorated significant given the pressures with ramping and other things across the health system, and I think you could say that for most of our health professionals in particular. We are absolutely committed to improving that and announced as part of our commitment to paramedics, for example, that we would do more to support them in their workplace around mental health and wellbeing checks, making sure that additional resources are put in place so that that reduces the workload for them across their clinical settings as well. The other thing that I would say around this is that it's an absolute priority for us. And when you think about working conditions, how that plays into mental health and wellbeing, obviously we would work around to close the gap across some of the disparities across wages, across the public and non-government workforce settings as well. And obviously the issues around retention and attraction, that's all part of the work that we want to do. And we would work closely with unions in that work, as we've done in the past and will continue to do, Jess, around improving that. I hope that answers that question.
Thanks so much, Anita. Guy, over to you on that same question.
Yeah, thanks very much for that. And likewise, Jess, thanks very much for the question. And certainly, I just want to say straight up in terms of the 2024-28 Work Cover Board and the WorkSafe strategic plan, which I know Jess would be fully familiar with, it does recognise the impact of mental health in all aspects of our life. And while some progress has been made in addressing mental health injuries in the workplace, there's still much more to be done to ensure that Tasmanian workers are not only safe physically and in body, but also safe in mind. So just to absolutely concur with that strategic objective. And the strategic plan reflects this by prioritising our mental health and wellbeing as well as prevention and management of physical injuries. But a key action of the current Rethink implementation plan is to develop a workplace mental health framework with WorkSafe Tasmania to establish a consistent and integrated approach to mentally healthy workplaces in Tasmania.
Great, thank you so much, Guy. Chris, we might throw to you now.
Thanks for this question, Jess. I am so passionate about this issue as someone that's in the mental health workforce and someone who provides care to people in our public service as well. I would love to see some reform in terms of our workforce accessing work cover. I can tell you it is quite a harrowing process. It can be a very damaging process. I was thrilled when there was the introduction of the presumptive PTSD legislation, but I can absolutely speak from experience in telling you all it is not working as intended. And I am so passionate about addressing this issue. I want to see our workforce safe. I want to see our workforce engaged, and I would love to see morale boosted across the board. I am so sad for my colleagues. I am so sad for our emergency services workforce. They are stretched beyond belief. Their morale is so poor, they're crying to me. Every time I go and seek services, it's always the same. They feel like our health services, our education sector is absolutely decimated after the last 10 years of services cuts. We have to reverse this urgently. Otherwise, we're going to keep staying in this mental health crisis that we have at the moment. We are losing our staff in droves. They don't feel valued. They don't feel like their expertise is recognised. And we have to get on this. We have to get on this with a matter of urgency. Otherwise, you're going to see us further and further into a crisis. Thanks, Chris.
Thanks so much. Thanks a lot, Chris. And finally, Rosalie, your perspective on this question.
Thanks, Jess. Such an important question. And I don't have to tell you, of all people, that in 2022, Parliament passed some legislation under the Work Health and Safety Regulations 2022, or they were passed under the auspice of the authority of Parliament. And that requires, puts a legal requirement on workplaces to address psychosocial hazards, and it has established a code of practice. The irony is that it is the government itself that places the most burden, mental health stress on workers at the moment, and that is not being addressed. And so here we have laws in place that puts the requirement on the worker, on the workplace, and yet here we have in the ambulance ramping inquiry story after people who say, nurses and paramedics who say they cannot work anymore because of the moral injury that is happening, because of the harms that are happening, and that they have to continue to work in a workplace where harms are happening because of a lack of investment and a lack of focus on making the changes that are needed. And that is exactly the issue that the Greens are fighting to change. We cannot have a situation where people are working day in, day out under such terrible, stressful situations. And another thing we'll do, as well as working to fix that situation and to put real money in to fix it, is to change the gag laws that are in place in Tasmania for public servants. They are the most strict in the country, the most unreasonable, and they're designed to shut people down if they talk about anything to do with their workplace. And that is such a broad scope. It has a chilling effect on people being able to just speak out about the intolerable circumstances they're working under. That's not right. That's not what happens in other states, and we are committed to changing those gag laws that are in place so that people can really talk about what's happening and we can get real change.
As are we, Chris. Might just add that.
Thanks, Rosalie. And sorry, did you just say something else there, Anita?
I did. I said, as are we, the Labor Party.
Thanks so much. Now, before I throw to Madison, there's been a couple of questions just come through in the chat, which I'm going to read out, and I might just get everyone to just give a sort of a 15-second response. Melanie has said, how are everyday Tasmanians supposed to afford mental health care? You need around $90 in your pocket to visit your doctor, often have to wait a couple of weeks to get in. You may need several visits before you can get a referral to a psychologist. You have to wait around 3 months to get in with a psychologist if they are even accepting new patients, and you need over $200 in your pocket for every visit. You're only entitled to 10 visits per year with the Medicare rebate. Health bills pile up with significant out-of-pocket costs over the course of a year. People can't afford to look after themselves. It's dire. Something needs to be done to address the costs. And an anonymous attendee has said, lots of good stuff from the candidates. Thank you. I still don't see how much needed increased spending in this sector is going to stack up in a budget deficit that keeps growing. How can you all guarantee that this will remain a priority, and where will the money come from? Because some sacrifice will have to be made. There is no automatically generating policy, unfortunately. So I won't get you to answer each of those individually, but I might just get a quick reaction to both those questions. I'll just whip around as I see you on my screen. So Guy, just a quick reaction to those questions from the crowd.
Yes, certainly. First of all, thanks very much for the question in terms of accessing mental health service, in terms of getting access to that service. My understanding is no referral is required in terms of that particular service. And I should note that in terms of our government's GP guarantee and getting access, obviously that's where the federal government has failed us, and we've stepped in, and we are stepping in, and that's part of our plan to provide access to a GP in the community. Obviously the bulk billing rates are low in Tasmania, and providing that GP in the community under our GP guarantee, access to 12 GPs, that's absolutely part of the solution, not totally the solution, but definitely it's going to make a huge help in terms of primary healthcare, with 40 extra GPs in rural and regional and outer metropolitan areas, and likewise $250,000 special grants for GP services. So that's part of the solution. Not all of it, but definitely acknowledge the question, and clearly there's a role there for the federal government to step up and support the community in this space.
Okay, thanks for that, Guy. That was terrible modelling of 15 seconds, but we'll forgive you just this once. Rosalie, quick response to those questions from the crowd.
The Greens have been fighting the erosion of Medicare for decades, principally under Liberal governments, but also, unfortunately, they haven't been repaired under Labor governments, and we are in a desperate situation. We're continuing to fight that at the federal level. At the state level, we have to be putting the money into public services. Every Australian, every Tasmanian has a right to free healthcare, free mental health care. And as for sacrifices that have to be made in the budget, yes, this is a heavy budget, and we don't apologise for the investment that we're putting into health and mental health, which is why we do think that we need to sacrifice having a brand new stadium, because there's a fantastic one at York Park, and we do need to ask big corporations to pay more money into the budget, because we can't be asking the poorest people to keep doing without these essential services.
Great, thank you, Rosalie. Chris.
Oh, thanks, Chris. I guess this is a really good demonstration of why you actually need people, practitioners and people with lived experience in government. So you do need a referral to access Medicare better access, which is what the person has been asking about. And yeah, you need to get into a GP. You need to be able to pay out-of-pocket costs. And we're seeing a really good demonstration here of our people in charge don't understand that. Right? So people just can't afford. They can't afford to see a GP. They will then be on a wait list if they can find someone at all. And then on top of that, you're out of pocket probably at least $100, if not more, every time you go and see a mental health professional. That is not tenable, particularly if you're on a Centrelink benefit. So you will forgo mental health care and healthcare if you are not on a decent income. That is not okay. We need to, the privatisation has not worked. It's not been the golden egg it was promised. So now we need to invest back in community health again so people can actually get mental health care when they need it. So we're seeing a really good example tonight of why it's so important to have clinicians and to have people with lived experience actually speaking up and saying what it's like on the ground. Thanks.
Okay, thanks so much, Chris. And over to you, Anita.
Thanks, Chris. A couple of things. I mean, rather than criticise the federal government, we'll work constructively with them, and we won't blame them for things. We'll work to try and find solutions, because that's what a responsible state government should do. There are, a number of issues around access to general practice. As I said today, I'm not going to go right through it when we announced our policy on general practice, but Chris is quite right in that there is obviously a failure in what's publicly available privately and publicly across the state. That's when the state government does need to step in and provide those community-based services. And if you're looking at early intervention, social workers play a really important role in that across community, and community-based psychologists. So the state does have a role to play in employing more of those allied health professionals across our community, and I've outlined our plan to do that. Look, there's no doubt the budget's in a terrible state, and that's after 10 years of this Liberal government. So we are going to have to think differently about the way that we spend money. The government says they're spending more and more money on health each and every day, but Tasmanians' health status isn't improving. Their access to services isn't improving. So it's time that you think differently about the way that you spend that money. And we do need to flip and look at community-based services and preventative intervention services, and whilst providing funding to the acute care sector as well.
Thanks so much, Anita. Now, as a former candidate myself, I understand wanting to say all the things. We've got 14 minutes left. We're going to try to get in one more question from each of the panelists. So if we can just keep these answers reasonably tight. But Madison, back to you.
Thank you very much. So the next question I have is pretty close to home. As someone who suffers with bipolar, I wish that there was more preventative measures that could have been taken to help me, rather than land me in a lot of crisis care that I do need now. So my question does focus on that prevention. Mental illness doesn't encompass the entire experience of Tasmanians when it comes to mental health. What emphasis do you place on the promotion of positive mental health, prevention of mental health problems, and early intervention? What actions do you intend to take in regards to this?
Great. Thanks for that, Madison. Anita, we might start with you this time.
Okay, so I wholeheartedly support what you say, Madison, about it being a holistic approach, and that you need to have obviously educational programs, prevention, early intervention, and then acute services that are available for Tasmanians experiencing mental health crises. So I've outlined a number of our policies around that, being the mental health checks for young people through community health centres, employing more social workers across the community, the school mental health services that we hope to improve as well. I mean, it starts really from day one for young people if they're well supported in their school environment. And we have a number of other initiatives around community-based services, like rolling out PACER right across the state, which has been very successful. That is people do access that service at a critical point when they're in crisis, but I think it's important to mention that as well, and to re-employ psychiatric emergency nurses across the state as well, so that if someone who presents to an emergency department wanting mental health support or clinical treatment can be assessed by a psychiatric emergency nurse as well, which does assist with their assessment while they're in hospital and the supports that are provided to them. So we've got a range of a whole raft of policies that I could talk you through. I'm happy to do that with you offline, because I know that I'm conscious of time and other people want to provide their contribution as well.
Thanks so much, Anita. Guy.
Yeah, thanks very much, and thanks again, Madison. And I think there's a real pointer there in terms of the importance of early intervention, prevention, education and awareness. And in terms of, just want to acknowledge the Mental Health Council's check-in, Take a Minute campaigns and Mental Health Week. Obviously, they're all important in terms of building understanding, putting value, taking charge, helping people take charge of their mental health and well-being, because we can all consider the things that we can do and often already do that have a positive impact. As part of the rethink, we're working to update the Tasmanian government's the mental health promotion, prevention and early intervention framework, and that's certainly part of the solution for sure. The rethink also involves increased support for communities to develop and implement community action plans for grassroots mental health and suicide prevention initiatives tailored to their needs, and we'll continue to deliver on our connecting with people training to help build knowledge and understanding across the state service in primary healthcare, such as GPs, which I mentioned earlier, and in frontline community services to help them respond and support people in distress.
Thanks so much, Guy. Over to you, Rosalie.
Thanks, Madison. We take a holistic approach to reducing the pressures that people are facing and living with every day, with the aim of reducing the mental health impacts that inevitably rise for most people who are faced with unbearable pressures in their lives. And that relates to cost of living increases, not able to get a home, not able to get support to escape from family violence, and not able to get a job. And so part of our commitments is to fight for free public transport and to fight for action on the housing crisis, for people who are renting, to have rental controls. These are part of the package of things that lead to unbearable stress for people. Also, we have a commitment to providing services for people who for early mental health support in regions, in locations. And that is a real commitment we have, to fight to have regional services, local services, so that people don't have to travel to cities and be away from their community and make the difficult trip of doing that, which is very, very far for a lot of people. And and support for the community organisations that are doing the work of providing support to people. And at the moment, as other people have said, Chris was mentioning it, it is those services themselves that are under unbearable pressure, and that is just limiting their ability to be able to provide early intervention and support for people. And that's who we should be putting more money into, community organisations, so people can stay as well as possible, but still get the acute care when they need it, obviously.
Thanks, Rosalie. And Chris.
Thanks, Chris. Thanks, Madison. Such a great question too. And I am so supportive of early intervention. I'm also really supportive of actually asking our young people in particular what they need and letting them inform services that they need. It's really important that we actually invest in our community-based services, because they're the first contact, and we need to have services where any door is the right door. So you can go to your local person that you're most comfortable with, and you don't have to go and retell your story umpteen times, as I'm sure Madison has had to. So we need lots of support. We need increased funding, but we also need innovative programs like intergenerational programs, where, you know, we can even have like a peer-led support programs, which are incredibly important. So I guess early intervention for me and supportive measures like being able to access good nutrition, affordable housing, affordable care is really where it's at. And I think we've not seen a lot of investment in that during this election, and that's where I would like to focus.
Thanks so much, Chris. Connie, your final question, please.
Thanks, Chris. I'll make it a really small one and focus on significant gaps in the data around who, how, and when people with mental health issues access services across Tasmania. This is including a lack of information about which acuity of patients access which levels of the service system, or about the appropriateness of movement of people between different levels of the service system. So the question posed is, how important do you think it is to address these gaps, and how would your party, if elected, approach this task?
Okay, I'm looking for a rapid fire response, please, everybody. And I'm going to cut you off if you don't follow the rules this time. Chris.
Look, obviously gathering data is really important, and that's one of the facets that really informs what kind of service you can provide. So that's vitally important. It's also really important so people don't have to keep telling their story over and over and over again, which we know re-traumatizes them. So it's not an easy question, this one, because I understand it takes significant funding to invest in that particular area, but it's vital, and I think it's part of providing an overall comprehensive mental health service.
Great, thanks, Chris. Rosalie.
Well, the Greens have been at the forefront of really demanding that this government provide information about what's happening to whom in the health system and what the impacts of that are. So that's why we got the ambulance ramping inquiry up, after trying to get information about the impacts on paramedics, on patients and other things. So it's critical that we understand not just who's receiving services, but how old they are, what gender they are, what part of Tasmania they live in, and then we can craft services to meet their needs. So we fully support having that information, and we need to have a government with a culture of transparency, not one that is, you know, hiding information, which has unfortunately been what's happening, and we can't normalise that. It has to change, because we all want to work together to get the best services for people, and that requires understanding what's happening and just being upfront about where things need to change and where investment needs to happen. Thanks,
Rosalie. Anita.
Thank you. Well, it's a really important question on a really important matter. If you don't have good data, then that doesn't inform good service delivery. So I think that's, you know, a case in point of what you're seeing across the state now, and what I spoke a little bit about before, about understanding what's being delivered to whom and where, and how we can improve that and how we can identify gaps. So we would absolutely work with the sector to garner this data and improve service delivery in response to it.
Great, thank you, Anita. And finally, you, Guy.
Yeah, thanks very much, Connie. And it is an important question. It's important to address the gaps in data, so we support that. In fact, it has been happening. And I know it's important to the Premier. It's happening through the mental health reform program, the Rethink Work, and it's in collaboration with the federal government. It's primarily working with Primary Health Tasmania, or PHT as they're often known as. And that bilateral agreement with the Commonwealth, it's called the Central Intake and Referral, and it's all about reducing duplication, increasing efficiency, getting better outcomes, triaging the process across the whole sector. So we're absolutely supportive of that. I know the Premier and Minister for Mental Health and Wellbeing is totally committed to that, and working collaboratively with Primary Health Tasmania to get those outcomes and make it even better. And that's absolutely a commitment of our government, and we've been doing that. Massive investments, in fact, record investments, and we'll continue to do so.
Great, thanks, Guy. And the final question goes to Jess.
Thanks, Chris. It's just a small question, everyone. This question actually spoke to me as a parent, so I'm just going to fire with it. Young people with mental health difficulties facing an inability to access that primary health care. So we're talking GPs. You tell me if you can find more than a couple of paediatric psychiatrists in this state, and I know a lot of mums and dads out there who'd like to know which paediatricians have an open book anymore. So how will your parties, your governments make sure that kids and young people can get assessed, supported and intervention in Tassie?
Great, thanks, Jess. Rosalie.
Hi, I feel like we've had this conversation with this question before, but maybe it was a similar question. Thanks, Jess. It is incredibly important to get early access to support, and that is why we support extra social workers in hospitals, in schools, and extra psychologists. And in order for people to be able to get early access to support and appointments, there has to be the staff at the other end able to provide that service, and that's why we've put a big package of support in to attract people who are working in the public sector, to provide incentives for them to take up employment in Tasmania and to stay in employment in Tasmania. And I think that's probably, there's a lot more I could say about
we'll leave it there.
Recruiting and retaining people, but essentially having people in place to provide the services as well as the investment that's needed to have more staff.
Thanks so much, Rosalie. Chris.
So look, this one is really close to my heart because I have a little person who requires early intervention, and I've been through this process, and my goodness, isn't it tough? Yeah, look, it is incredibly hard to find a private provider. You're waiting 2 years to get into our public disability services for little people. You're facing a similar wait when you're looking for private providers. And then you've got to run the gauntlet of an NDIS application. But you need to be able to access those providers in order to access an NDIS plan. So it's a bit of a nightmare. As a mum, I am so passionate about this because early intervention, we know early intervention before the age of 7 is linked to really good outcomes. And I can tell you kids are missing out at the moment. We're not talking months, we're talking years. So I am so committed to this particular area, and I want to see our publicly funded services actually funded adequately so our little people can access the services when they need it and not have to wait 2 years for an autism assessment.
Thanks, Chris. Guy.
Yeah, thanks very much. It's a two-part answer. Thanks very much for the question. It's a really good one. That's why the Premier and I announced support for children with ADHD and getting access in both the north and the south of the state, with a special pilot over a number of years for GPs with a special interest in ADHD employed by the state government through the Tasmanian Health Service. So that's the first thing in terms of that. Secondly, just overall, the importance of where we've been let down by the federal government in terms of getting access to GP services. We have stepped in. We stepped in St Mary's, we've stepped in Bridgewater, we've stepped in East Devonport. We've now released our policy, which is focused on primary health care, getting access to a GP when you need it, the GP guarantee. We're employing a dozen GPs in the state service, or 10 GPs in the state service, and they will go into those places where there's a market failure. Secondly, we're going to have 40 more GPs. We'll be paying their HECS fees, $100,000. They will be bonded for 5 years in rural and regional and outer metropolitan areas. And then finally, $250,000 grants for GP practices to get access to those services that they need. It might be extended hours, might be nursing support, nurse practitioner support, or upgrade their GPs in those areas where they can do that. So we're absolutely focused on primary health care because it's absolutely essential to the health of Tasmanians. So I think it's a really good question, and we've got a very key policy position there for the Tasmanian people to consider it next Saturday.
Thanks very much, Guy. And finally to you, Anita.
Thanks, Chris. So the question really was about specialist services, I think, rather than general practice. So we've got about 58,000 people across Tasmania waiting to see a specialist of some type, and children are no exception to that, particularly when it comes to paediatricians. I spoke about our plan around ADHD, but really we do need to be doing more around telehealth services for families to be able to access, whether that means that we're working with other jurisdictions to provide that service. And obviously we would look to do that in government to make sure that people can actually get those appointments. The other thing that we are doing is around rural generalist doctor training across the state, and nurse practitioners as well, where they would have specialised skill sets around mental health and wellbeing as well, and obviously an interest in working with young people in more regional communities. That's another way that we've looked at addressing this. The other thing about this is that a lot of our mental health facilities across the state are ageing, and they need investment, and the government's made lots of announcements about master plans but haven't really delivered very little, and that goes a long way to attracting people to come and work in Tasmania, professionals, and we need to do more about the quality of the facilities that we have here, and I guess the professional opportunities for people in Tasmania to come and practice, so that they do choose us as a place to establish their practice and service our community.
Thank you so much, Anita. And thanks to everybody. Thanks to our politicians and our candidates, Guy Barnett, Rosalie Woodruff, Chris Hannon and Anita Dow. I really appreciate you all taking the time in your busy campaign schedules. And of course, to our panelists, Jess Mundy, Madison Cutler and Connie DeGolis. On behalf of Australians for Mental Health, I want to thank you all for joining us tonight, whether you're watching us live or watching it on the internet over the next few days. Mental health needs to be an important issue at this election because it is such an important issue to every Tasmanian and, in fact, every Australian. Australians for Mental Health exists to try to campaign and agitate for the changes we so desperately need to the way Australia does mental health. Whether you lead a government, lead a workplace or lead a family, everyone has a role to play to make sure that Australians can live their best, most mentally healthy lives, and that's 100% our focus. As you jump off this call, you will get invited to chip in a few bucks if you can. We have no government funding, and so we do rely on people's donations so that we can start this conversation and make sure that mental health becomes a top priority for everyone in Australia. Thanks again. Good luck to all of the candidates. We'll be watching keenly to see how you all go. And more importantly, whoever does get elected next Saturday, be rest assured that between Unions Tasmania, the Mental Health Council of Tasmania, I'm sure any number of people with lived experience and Australians for Mental Health, you're going to keep hearing from us over the next parliamentary term. So together, hopefully we can have a much better situation for mental health across Tasmania. Thanks very much to everybody and good night.